So our first speaker tonight is a fellowship-trained cardiologist practicing cardiology at Ascension Columbia St. Mary's here in Milwaukee. He is past president of the Wisconsin chapter of the American College of Cardiology, and he's also a member of the National American College of Cardiology's prevention subgroup. Some of the other members of that group include nationally known physicians like Dr. Dean Ornish, Dr. Caldwell Esselstyn, and Dr. Neil Barnhart. Our speaker is an advocate for the use of plant-based nutrition to help improve heart health, general health, and quality of life. And he's seen the benefits of plant-based nutrition in both his personal life and that of his patients. We're fortunate to have him practicing here in Milwaukee and with us tonight. I'm happy to welcome our first speaker tonight, Dr. Joshua Liberman. Dr. Liberman?
Thanks, Terry. Thanks as always. Good to see you all here. It's really impressive to see everybody coming back month after month. I know that many of us are tired of Zoom at this point. We're tired of having to have community through the screen. It's hard, and we're all getting fatigued of this kind of stuff. But I appreciate you all being here. I appreciate the commitment, and I appreciate the interest and the vitality and the interest in learning more about and hearing more about plant-based nutrition and prevention in general. So, as you know, I kind of like to talk about, just some recent clinical experiences that I have just in my office, but also like to, do so that's kind of some anecdotal stuff, but I also like to, give you an update on just some literature as well. In terms of the anecdotal stuff, I guess I saw a patient the other day that made me want to talk about this specific thing is that, I have a patient who's been plant-based for a very, very long time. He's in his mid 70s and has been, sailing through life from a health standpoint, certainly, with just excellent health, not on any medications, feeling good, active, and just, enjoying life as we all should if we eat healthy for a long time and stay active for a long time. But of course, he ended up in my office anyway, unfortunately, because he actually developed atrial fibrillation. And he's really disappointed because he said, I don't understand how this can be. I'm plant-based, I'm healthy, I do everything right. What did I do wrong? And and it struck me as unfortunate that that even though we know that there are tremendous benefits to this lifestyle, it's not a miracle cure. Like there are still things that can happen. Unfortunately, you can significantly reduce the chances of bad things happening by eating plant-based, by exercising, by taking care of yourself, by being healthy in general, by, obviously not smoking and all the, and avoiding, environmental exposures and all these things. But things can still happen. Like no one ever should or can promise that nothing bad can happen to you when this happens. And we know that, there is actually a lot of research that suggests that even, extremely healthy people can develop atrial fibrillation as they get older, and maybe it's a slightly different population, but there's been studies of elite athletes, people who, run ultra marathons or they've done a study of Tour de France cyclists. So obviously, these are people that have been, in absolute excellent shape throughout their lives. And when you look 20 or 30 years later after, as they're older, they actually have a higher incidence of atrial fibrillation. Now, they have a much lower incidence of cardiovascular death and death from other causes because they've been so healthy, but they do have a higher incidence of atrial fibrillation. And so, there's a lot of reasons for atrial fibrillation. It could be genetic. It can just be from some, if, as I said, you're an athlete, you can get some fibrosis of probably the upper chambers of your heart over time that can happen. But I guess, what I wanted to raise, what I wanted to highlight with this anecdote is that there's enough bad stuff happening in the world for us to get upset about. I don't want people to get upset about themselves, about what they're eating, or feel guilty or that they're doing something wrong, right? So we should, and I've said this multiple times before, we should really, work through health in a positive direction, feeling good about ourselves, being proud of ourselves, instead of feeling guilty because we're not entirely plant-based, or feeling guilty because we haven't, been able to make that final step. Not everybody on this call is 100% plant-based, and we don't want to do a call with only people that are vegan or plant-based, right? The whole point of this is that people learn, people listen to this, people try things in their lives, people move in a healthier direction, and that's really the key. But I, again, and I've said this before, but I want to say it, I really want to put emphasize it. We should not feel guilty about what we are or are not doing. We should just, look to move forward and try to get healthier, every day, every week, every month. So that's the anecdotal, from my clinic kind of talk. In terms of some research that, it's always fun to update you guys on some research. And one thing I want to highlight is, a lot of times, in these meetings or in these things, we highlight the benefits of legumes and, all sorts of different, beans and nuts and things like that. And Amberly is phenomenal about teaching us how we can use a lot more of these things in our diet. But one thing that sometimes we don't spend a lot of time on is fruits and vegetables, because I guess maybe we take it for granted. I mean, fruits and vegetables are part of a plant-based diet, and we all, and a lot of us eat fruits and vegetables. But I wanted to highlight something that came across, my desk a couple months ago. I saw in one of the journals in the Annals of Internal Medicine, which, as you know, or as you may know, is not always so pro-healthy diet. They publish a lot of editorials and stuff that, say that that red meat really isn't as bad as we think it is, and sugar really isn't as bad as we think it is. But this one article and an editorial in the Annals of Internal Medicine a couple months ago was interesting to me because it really highlighted the benefit of fruits and vegetables. It was a study that actually looked at 3 different diet types. Basically, it was the DASH diet. It was a diet that was enriched with fruits and vegetables, and a typical, SAD American diet, the standard American diet. And what it was looking at, wasn't, long-term outcomes of, stroke rates and heart attacks, because it's really hard to show that in an observational trial. You really need to do a long-term, you need to do a large population to see that. But what this was looking at was some subclinical markers, we call them biomarkers of cardiac damage. So it was looking at something we call a high sensitivity troponin assay. So that's an enzyme that is found in heart muscle cells, and it would only ever be released into the bloodstream if there was damage to heart muscle cells. It's not found in any other muscle cell, skeletal muscle, or anything like that. And so you can do this test that looks for just infinitesimal amounts of this. So it's the high sensitivity troponin test. And then there's another hormone that's released by the heart when it's under strain called BNP. So that's B as in boy, N as in Nancy, P as in Paul, BNP. And so both of these tests, when used together, can really highlight some very, very subtle strain on the heart. And so it would make sense that we might be able to use these tests to see if diet affects people's heart health, if exercise affects people, if high blood pressure, cholesterol, all these kinds of things affect heart health. And what this test showed was actually that there was a decrease in a noticeable, statistically significant decrease in levels of cardiac troponin and proBNP, or as I said, the hormone that looks at strain on the heart, that was lower in patients that had diets that were enriched with, fruits and vegetables. And so, why is this? Well, fruits and vegetables have obviously tons of wonderful things, nutrients, phytochemicals, fiber, polyphenols, carotenoids, all sorts of different things. And so it really highlights the benefit of having a significant portion of fruits and vegetables in your diet, because you have lower amounts of these very, very sensitive assays for strain on the heart. So you might ask, well, how many fruits and vegetables, how many servings of fruits and vegetables should I be expected to have in a day? Well, there was a related meta-analysis. So it looked at almost 100 prospective studies, and the conclusion of the meta-analysis said that basically for every increase of 2.5 servings per day of fruits and vegetables, so that's really just, it works out to 200 grams a day. But for every increase of 2.5 servings per day of fruits and vegetables, you had a decreased risk of heart disease by about 15%, decreased risk of stroke by about 15%, decreased risk of all-cause mortality, so dying from any cause, by about 10 to 15% as well. And if you could boost your fruit and vegetable intake up to greater than 10 servings per day, the risk of heart disease was reduced by 24%, stroke by 33%, and all-cause mortality by 31%, right? These are numbers that are unheard of with really any medical treatment, with any interventional treatment, stents, or any kind of thing that we can do in any medicine. To be able to decrease all-cause mortality by 30 to 31% just by boosting up your fruits and vegetable intake up to 10 servings a day, beats anything. And so, sometimes people ask the question, just to finish up, sometimes people ask the question, oh, well, does it have to be raw? Should it be cooked or whatever? I think many of you know by now that I'm not an anti-oil person. I think that the data suggests that something like olive oil is a beneficial part of the diet and is beneficial for human health. And there have been studies that have looked at that cooking, simmering vegetables in olive oil in the sofrito kind of fashion enhances bioavailability of carotenoids and polyphenols and a lot of other things that you wouldn't normally be able to get access to because they're within the cell wall, of the cells of the vegetable. So, eat more fruits and vegetables. Don't, of course, forget about beans and lentils and chickpeas and peanuts and all that other stuff as well. But I think that I tried just to highlight that boosting servings of fruits and vegetables alone can dramatically improve heart health, but also overall health. So with that, Amber Lee and Dr. Klaper, I look forward to hearing from you both.
Thank you so much, Dr. Lieberman. That was outstanding, excellent information. It's great to get recent studies to hear what's coming out and which the whole idea here is to remain evidence-based, and it seems to time after time after time, the information that comes out seems to confirm what we feel already. So, thank you so much. Our next speaker will be leading a group discussion, and this will be a relatively short group discussion. Before I introduce her, let me cover a technical note again. During the discussion, please use the Zoom chat function, which is should be down in the icons in the middle of your bottom of your screen. You just click on that, and you should get a nice white box that comes up that you can drag off to the side if you want, and where you can type in questions or comments and then hit enter for everybody to see. Our next speaker is a plant-based cooking instructor trained and certified in the Food for Life program run by the Physicians Committee for Responsible Medicine located in Washington, D.C. One of the many wonderful things that PCRM does is train and certify instructors to teach people how to incorporate plant-based nutrition into their daily lives. There are a number of Food for Life certified instructors in the country, but many areas of the country don't have the luxury of having one nearby. We not only have one here in Milwaukee, but she is excellent. To lead our group discussion and update us on upcoming plant-based cooking classes, here is plant-based cooking instructor Amberly Childs. Amberly? Amberly?
Yep, I never unmute, but I think we got it now. As I see heads bob and people giggle. Hello, everybody. Good evening. It's nice to be here. Tonight, our discussion that we are going to be having, last month, we talked about meals that we could be eating. And so tonight we're going to switch it and we're going to talk about snacks. And so what are snacks? Because I think we all, when we talk about cooking, it's great. I would love to be in the kitchen for every meal that I made. But the reality of that is that we're not in the kitchen as often as we would like. And more than likely, we're grabbing things on the go. That means I'm running by the fridge. What can I grab quickly? And typically fruit is one of those easy things that we go to and we can kind of grab and take it with us on the run. I really love fruit because one, it's like bananas are self-contained. The apple is kind of contained. It doesn't get completely damaged when I toss it in my bag. So the fruit is the go-to. So what I want to do is I want to open it up for discussion. And this is where we're going to use our chat box. And I want to hear, what is one of your favorite go-to snacks? And I'm going to tell you one of mine, and you might think, that doesn't sound easy, Amberly, but it is if you do it ahead of time. So one of my favorites is a sweet potato with a little bit of cinnamon on it. And I cook the sweet potatoes ahead of time. And so when I'm thinking of them in, well, now I have a year and a half. Oh, my baby is a year and a half. So I'm introducing these other foods to her. So sweet potatoes are something that we eat a lot of here in my house. They're naturally sweet, but I really like to get the smaller ones that are maybe a little bit more like, I'm trying to look here, more oblong. And so they're smaller, they cook up a little quicker, and I'll cook like a whole cookie sheet worth of them, right? Cook 10, 12 of them, and then they're cooked ahead of time. And then I can leave them in the fridge in a glass or a Tupperware ready to go, or I could freeze them. So that's one of my go-tos because it's going to give me a lot of energy. It tastes that, get that little bit of sweetness. I can put a little salty on, so it gives me that, it just really satisfies me by getting the sweet and the salty together. And then the cinnamon, just extra benefit right there by adding in some good old cinnamon, right? So that's one of mine. So I'm going to look over here at my chat box and see what we have coming in. So we got dried fruit, apples. Dried fruit's really good because it doesn't really go bad, right? It's going to last a whole lot longer than that fresh fruit. And you can add it to raw nuts. That's the nuts and dried fruit are one that I typically travel with on a plane. Not peanuts, but other types of nuts. Those are a real good go-to when I like to travel. I like this one. Elaine commented that she steams small red and yellow potatoes and she keeps them cold in the fridge. Yeah, I do the exact same thing with my daughter, Elaine. I love those little ones because they can just kind of cut them in half. I can give my daughter half of it, a quarter of it. You can eat them cold, you can warm them up, and they're awesome. And they kind of satisfy us in the same way that a sweet potato does. They're real complex carbohydrates, and so our bellies love them. But then at the same time, they're going to give us a little bit of gas over the duration. It's not just going to spike our blood sugar and drop it. It's going to continue to fuel our bodies throughout the day. Figs, raisins, and mangoes. I'm hearing from Warren. I'm not a fig lover myself, but people who like the fig love the fig is what I've come to find, that there's a whole group of them, and they're really high in fiber, believe it or not. Figs are. They can be very similar to dates, blended up and used as a sweetener, and can be included in things. Dates with cashew butter. Okay, Eileen, now we're getting decadent here. That's a really good idea because so once again, it fills in that sweetness that's coming in. We've got dehydrated carrot sticks and beet chips. That's really interesting. I like that because we can now start to find more dehydrated things. I buy, what are they called? I'm looking at some of them here on the table. They're like freeze dried, like fruit. I call it astronaut food in my house, but the baby loves that, and they're really easy to take around. And so I think you're going even healthier when we start to do the vegetables that way with carrots and beet chips. All right, so Donna is going to just top us all off. Donna and Katie are coming in super healthy here. How about a sliced tomato with California balsamic? How about a little salt on that, a little balsamic? I'm not a big tomato lover, but I think if you put enough balsamic on it, it will just turn into like some delicious Halloween candy or something like that, that you're like, is this really good for me? So Katie's commenting cucumber with lemon juice, sea salt, and a side of hummus. I could do the same thing, but you could then substitute carrots. You could put in your celery. What about red pepper or any of the red, yellow, or orange peppers that tend to be on the sweeter side? Green's going to be a little bit more mild, but the peppers are really good. If you cut them in long julienne strips, you can use them to dip in peanut butter, almond butter, hummus, a handful of those things. Peanuts could be good, yes, but obviously allergies would be someone who you'd be concerned with. I'll tell you, here's one of my, if I'm feeling like I just need to have a good old staple, because I'm from the South, I make boiled peanuts. And most people from the North don't know what that is, or the Midwest, but basically you take raw peanuts and you boil them for 2 days, 48 hours on the stove. And you put a lot of crushed red pepper, salt, garlic, different things in there. But they have the juice that comes with them is so great. And so I have to control myself because I can take in too many omega-6s by eating the peanuts. So that I think is kind of the negative side of the peanut if you don't have an allergy, is that they tend to be a little higher in our omega-6s, and we want to get a more of a balance of our omega-3s in there as well. Oh, here we go. Donna is talking my language here. Air fried potatoes with a dash of malt vinegar. Oh boy, did somebody say fish and chips? Yeah, what I like about that, one, you're using the air fryer, Donna, and that's great. I use my air fryer to reheat leftover food. And that can be a really good snack for you as well. Here's my husband did this the other day. We made pancakes and he threw the pancakes in, like just like 2 or 3 of them in the air fryer, reheated them for like 1 or 2 minutes, and then he ate it as a snack, put some jelly on it and ate it as a snack. So use that air fryer to reheat leftover food, and potatoes are a really good one because they'll crisp up nicely. But I love the use of malt vinegar, as it's really going to satisfy that saltiness that you're looking for, that we look for in a chip sometimes. And it's probably going to be healthier for you than maybe using a sugary ketchup of some kind or a mayonnaise like some people might put on French fries. Garbanzo beans roasted and plain. That's yummy. I've even taken garbanzo beans, put a little cumin on them, a little vegetable broth, thrown them in the air fryer, and they can come out like a crunchy treat now. And that can be something that you really can get that crunch on. You're still getting fiber. The fiber did not go away because you put it in the air fryer. It's still there, but you're going to get that crunch that comes with it as well. So Rebecca, we'd like to invite you to make your peanut butter balls for our next in-person meeting, because Rebecca makes some good peanut butter balls with a non-sweetened coconut, oats, dates, cinnamon, ginger, clove, cardamom. I love cardamom. It's one of my favorite spices. Hemp and chia seeds. So what I want everybody to hear with this, and then she even throws in some astragalus to really bump that immune system up there, right? What I'm reading here on Rebecca is she's taken the pantry and she's made it into a little ball. And that's delicious. It's high in fiber and it's going to really satisfy that sweet tooth. And you could eliminate a handful of the ginger, the clove, the cardamom, cinnamon, the chia, or the hemp. You could have one or the other. You don't necessarily have to have all of those, but it sounds like she's really fostered up a really fantastic recipe here. So I got a couple more and then I think I'm going to end here, but guacamole, how about good old fashioned guacamole? What about just avocado toast? I got a half an avocado that I didn't finish from yesterday, and I'm just going to throw it on some toast. For me, I like toast, avocado, and a little sriracha. But that's just my little spicy palate there coming into play. But it changes it up and it adds a little variety to it is what I see. Oh, you guys are great. Okay, so Deborah has frozen banana smashed with coconut powder, cinnamon, and soy yogurt. I'm gonna have to try that one tomorrow. That sounds fantastic. And if you even left the banana frozen and did that, you'd have ice cream, which is so great. So we are just over, and I know Dr. Klaper has some really fantastic information for you tonight. So I do not want to delay any longer, but I tell you what, you guys have been really great with your suggestions. So thank you for playing along. When we get back in person, we really can't wait to continue to foster these discussions, because we all have great nuggets of information in our head, but when we collaborate and we share, we empower each other to be better at what we are doing, and we empower each other to stay on the journey. And I love what Dr. Liberman said about some of us are not 100% plant-based. And, you know, I call myself 95 to 98%. But, you know, my husband is a little bit less from time to time. But what's important is that if you were 75%, if you were 80, you're on your way and you're doing so much better than most people out there. And one day, if you're 75% plant-based, you'll be 80. And then the next day you'll be 85, because as your palate changes, you're going to be introduced to new foods, you're going to get excited, and you're going to be supported in that. So stay on your journey, keep working on different fruits, vegetables, grains, beans, legumes, and nuts. Get those babies in your body, because they are really our medicine. They're your fuel, and they're going to help keep you through the day. We're going to follow up in an email, but our next cooking class is going to be on October 22nd, Thursday night, and then we're doing breast cancer fighting foods. So I'm doing a whole profile. Every food we're bringing in is just really big. Breast cancer fighting foods, high in fiber. So that class is available on my website at plantjoy.net. Also, we've got a fantastic soup this week. I'm cooking an African peanut stew. It is available. It gets delivered Monday throughout the greater Milwaukee area. All you got to do is go to my website, plantjoy.net, put in your little order. I want African peanut stew, and it will show up at your house, and boom, you will be eating plant-based deliciousness next week. So thank you guys for having me. I appreciate it. Thank you for playing along with your snacks. And I will now turn it over to Terry and Dr. Klaper for his wonderfulness. Thank you, guys.
Great. Thank you so much, Amberly. That was fun. And just to mention, as far as these discussions are concerned, Amberly and I will be talking. Don't hesitate to give us some suggestions too on the topics that you'd like to have covered. And this is obviously something that people really enjoy, and it gives everybody an idea of what other people are doing out there. There are some great ideas. I was taking screenshots of this stuff. So I'll be trying some of these too. So thank you, Amberly, and thank you everybody for participating in this. Now let's get to Dr. Klaper. Our featured speaker tonight is a classically trained Western physician with postgraduate training in internal medicine, surgery, anesthesiology, and obstetrics. He's been in general practice for over 40 years. He is a pioneer in the use of plant-based nutrition in clinical practice to help his patients improve their health and fight disease. An author of books and articles, he's a regular speaker at healthcare conferences across and outside the US. He's been featured in healthcare documentaries, including What the Health, Cowspiracy, and the Diet for New America, and is a passionate, devoted educator of physicians and other healthcare professionals about the importance of nutrition in clinical practice. 3 years ago, he was given the Plantrition Project Luminary Award, which is the signature award given each year at the International Plant-Based Nutrition Convention. To an individual who has done an exemplary job during their career advancing whole food plant-based nutrition as the foundation of disease prevention, suspension, and reversal. Other winners have been other giants in this field, such as Dr. Dean Ornish and Dr. Neil Barnard. Most important of all, he's helped thousands of people lead healthier, happier lives by opening their eyes and giving them the power to heal themselves. He is speaking to us tonight from, I think it was North Palm Beach. You can tell us again, Doctor. It's a great pleasure to welcome our speaker tonight, Dr. Michael Klaper. Dr.
Well,
Klaper.
Thank you, Terry. Really appreciate the kind words. Hello, Milwaukee. It's great to be with you. And boy, last time I was with you, we Skyped in. There were 40 or 50 of you with great camaraderie in a meeting room. And who'd have ever thought that that would become a quaint, antique human activity? It seems the way it is in the distant past. What unusual times we're living through. But I too am suffering from Zoom fatigue a bit, but thank heavens for this technology that so many of us in distant places, distant situations. Whoa, who's that, Amberly? Who just joined us here? So somebody unmute there.
That's Kinsey.
Yeah, I'm sorry, that's my daughter. She just came back from her walk.
Oh, she's lovely. Oh, Hi there. Hi. All right. Hello there. Good evening. Nice to see you. Glad you're able to join us. Okay, great. What a great presentation Amber Lee just gave. Colorful and vibrant, as is the cuisine, as the food, and unlimited, limited only by our imaginations and our taste buds. And this cuisine is so forgiving and plastic, and it has such great plasticity and in the ways that you can present it. And that was just a beautiful presentation, as well as everybody's contribution, no doubt. And what a thrill to hear Dr. Liberman, a plant-based cardiologist. He is my growing collection. He probably knows a lot more than I do. There's probably a lot more than I think. So far, my team of acquaintances in the cardiologic world, Dr. Monica Agrawal at the University of Florida in Gainesville, Dr. Bob Osfeld at Montefiore Hospital in New York, Dr. Kaushik Reddy at the University of Florida in Tampa, and now Dr. Liberman is with us. And I have such respect for the cardiologists who have opened their eyes and hearts to the reality of plant-based nutrition, but who've looked beyond, who looked over the fence to say there's got to be something beyond putting in stents and increasing the dose of statins on my patients, because they're still getting heart attacks and strokes. Putting in a stent can be life-saving right in the middle of of an acute myocardial infarction. But nobody really, it doesn't, the entire arterial tree is affected. And just putting in that one stent might save the person from dying right under your nose there, but it hasn't really done anything for the health of their arteries. And as I was told long ago, a person years old as your arteries, and the cardiologists know that more than any others. And not only does my admiration go out to a plant-based cardiologist like Dr. Lippman, my compassion, almost my pity goes out to him. It's a lonely place to be in this day and age. 10 years from now, 20 years from now, it's going to be standard. It's going to be, what was the big deal? We've always known that plant-based diets open up arteries, but we're still in the dark ages where the plant-based cardiologist, Dr. Kim Williams, number 5, forgot about him in Chicago. They're living a lonely life in some ways, and I'm sure they get a little sarcasm, a little bit of pushback from their colleagues, because not only, he's that nuts and berries doctor over there. Now, I might be talking out of school. Dr. Liberman might have a whole team of colleagues that are open-minded and rooting for him. But I suspect very often he's not only disregarded because of that strange way that he eats. Man, can't have a steak anymore. But in a way, it's threatening. It's threatening, like everyone who adopts a vegan diet, in a way, people around them feel you're judging them when you're in the restaurant, when you don't order the steak or whatever. But also he's threatening them because of their financial income, not intentionally, of course. But if everybody practiced like Dr. Liberman does, and like Dr. Kim Williams is doing in Chicago, the patient's going to get healthier. They're going to be putting in a lot fewer stents. They're going to be doing a lot fewer coronary artery bypasses, and that's where the money comes in. And this kind of practice threatens that. And so it's a lonely path that this man is walking, and I have great admiration for him because he's also seen the truth. They say, once you look behind the curtain, you can't pretend you don't know what's behind the curtain. And Dr. Liberman's looked behind the curtain and he knows. He's seen those before and after angiograms from Dr. Esselstyn's patients and other patients. This is a reversible disease. And once you know that, how can you be satisfied with just, well, let me increase your dose of lovastatin and come back in a couple of months. And you hope they don't have their heart attack when you're on call. That's a dismal way to practice medicine. And no wonder so many of our colleagues are leaving medicine. They're all getting fatter and sicker. They all need stents. They all need, yes, right, doctor. Don't talk to them about what they're eating. Keep letting them eat cheeseburgers and buffalo wings and pepperoni pizzas. That's what you're going to see. And all the statins in the world are not going to save these people's lives, but changing them to a whole food plant-based diet will. And in the presentations that I give to the medical students, I put up a slide with the classic degenerative diseases that kill most people: obesity, diabetes, hypertension, atherosclerosis, etc. And I clicked the slide. It said reversible. Every one of these reversible diseases. And then I clicked the slide once more, and a question comes up with those diseases still showing. And I said, this question is going to make you a little uneasy. But knowing that how reversible these diseases are, and I clicked the slide, the question asked them, you want to heal these patients or don't you? I mean, really, why'd you go into medicine? You want to heal these patients? If you do, then get real about their diet, about what they're really eating, because that's why they're sitting in front of you, doctor, obese and diabetic and hypertensive and clogged up and inflamed. It's not from some genetic mismatch on gene A21, chromosome 14. It's not just bad genetics. It's that flood of animal fat, animal protein, hydrogenated oils, high fructose corn syrup, phosphoric acid from the cola drinks, the alcohol, the cigarette smoke, the barrage, the chemical assault they inflict on their artery walls hour after hour. The stuff never clears out of the bloodstream. Bacon and eggs for breakfast, cheeseburger for lunch, chicken for dinner, ice cream for dessert. We live in the postprandial state. Postprandial means after eating. And nobody goes hungry in this country right now. And when you're a little munchy, you go to the fridge, you go out to the fast food place, whatever, and down goes something fatty, salty, fleshy, sugary. And that tide, that red tide of hydrogenated oils and cooked animal protein and fructose and all that floods through your tissues, causes damage in every organ system in the body. Pick one, they all get affected. Your microbiome changes, your immune system reacts, and your artery walls get injured. And the atherosclerotic process, I've spoken to cardiologists. I say, you folks, you're so fixated on these numbers. What's your LDL particle size? What's your ratio? What's the particle number? Trying to divine, who's going to get the heart attacks. They all will if you don't change their diet. But I say you become these fear-filled technicians ricocheting off these numbers. Instead, you've abandoned your birthright as biologists. The question is not how high is their LDL. The question is how healthy are their artery walls. Do they have that inflammatory fire of atherosclerosis burning in their artery walls, or don't they? It's an active biological process. They're not some benign, oh, my LDL's high, I'll just take my statins and lower it, and then I'll be okay. No, sir. That depends what you're running through those arteries meal after meal. If those meals are quinoa and greens and fruits and beans and vegetables, that fuel mixture gives the chemical message to your artery walls, shh, calm down, everything's okay, because they're filled with antioxidants and phytonutrients that promote tissue repair, that quench free radicals, that let inflammation subside. Where the standard meat-based diet and the processed foods and the French fries and all that send the opposite message of inflammation and tissue damage and glycosylation of the lining of the sugar molecules sticking to the lining of the arteries. This is not a random event. I had a wise professor in med school say, people don't get diseases, they earn them. Meal after meal, cigarette after cigarette, argument after argument, sleepless night after sleepless night, a day on the couch, watching your pot belly get bigger after day on the couch. That's how you earn these diseases. These diseases should not happen. Nobody should develop clogged arteries. I've delivered several hundred babies, and about 30 of them were to vegan parents, and I watched them grow up lean and healthy, eating all this lovely plant-based diet, and they'll never become obese. They'll never develop high blood pressure. They're never going to develop plaques in their arteries. It's their birthright to live a healthy, pretty disease-free life. As Dr. Lieberman said, there's no guarantees here. But, if you got a fine racing car, you put in the best gasoline you can, you take care of that engine. If you do, it's going to last a long time. But if you put in lousy fuel and never change the oil and never clean the spark plugs and let it sit in the garage all winter, what do you think is going to happen to that engine? Will you be shocked when the rings gum up and the fuel injector is plugged and it coughs and sputters black smoke? Oh, my car has a disease. No, it doesn't. It's the inevitable result of running the wrong fuel through the machine was not designed to run on it. So I have nothing but admiration for Dr. Lieberman here, and because he's on the tip of the spear here as we're trying to birth a whole new awareness in our noble profession here. He and I love this profession dearly, that it breaks our hearts. As the cardiologist with a broken heart, to see people dying when they don't have to from a self-inflicted disease. So I'll share with you an anecdote that was shared with me by Dr. Kim Williams, the lovely man. He's a cardiologist. He was the head of American College of Cardiology, and he's in his day job, he's the head of cardiology at Rush Medical Center in Chicago. And about a year and a half ago, I find myself on a panel with Kim down in Midland, Texas. Hey, Kim, how are you doing? Okay. I said, just okay? He says, yeah. I said, what's up? He said, as you know, I'm the head of cardiology at Rush. Yeah. He says, it's a big hospital. I did my pediatrics there. And he says, we're the main referral store for most of the Chicago area. We're a big referral center. And I said, yeah. He says, I've got 25 cardiologists working under me, which is standard for a big metropolitan hospital. I said, yeah. He says, well, because of who I am, he's a longtime vegan, an athlete. And he said, 14 of my cardiologists are vegan. 14 and 25 of his cardiologists are vegan. I said, whoa, man, you must get some great results for your patients. Oh, man. He says, people come in, they get the deluxe treatment, and we don't pull the punches on the plant-based diet. We link them up with a plant-based dietitian. She gives them lectures. She takes them shopping. She stocks their freezer, checks in on them once a week by phone. We really get them on the plant-based trail there. And I said, you must get some great results. He says, yeah. I said, well, why the hesitation? He says, well, these people come in god awful sick with clogged arteries. They're having angina and chest pain when they walk. They're having transient little mini strokes because their arteries in their brain are so clogged up. Their legs are turning blue from their bad circulation. I said, yeah. He says, so you get them on a whole food plant-based diet and you never see them again. Their arteries open up and you maybe see one side, they're gone. They got the message, they did it, and they're off to live a healthy life. And I said, well, that's great. I mean, that's what you're trying to do, isn't it? And he says, yeah, but we're big hospital here. We make our living putting in stents and doing procedures on patients. And the income from the cardiology department has just taken a nosedive, so much so that we got called in by administration. They said, what's up, doc? You used to be a profit center in your hospital. You're a loss leader now. What's going on? What's going on? We're curing our patients is what's going on. Isn't that what we're supposed to be doing? They said, yeah, but we're a multi-million-dollar operation here. You blew a hole in our budget here. And so what's to do? To talk about the irresistible force and the immovable object here. And enter my friend Ken Beckman, who I ran into at the Plantation Project meeting a couple of years ago. Being a clear-looking guy, I thought he was another doc, but he introduced himself. I said, "Are you a physician in practice?" He says, "No, I'm not a physician. I'm an actuary. I'm an insurance actuary, and I head the plant-based insurance actuaries of America." And I said, plant-based insurance actuary? Said, yeah, this is in my day job. I'm an actuary for Aetna, but I've been plant-based for years, and it's evident to us that the vegans, the folks eating plant-based diet, need a lot less medical attention. And he says the numbers work like this. The bean counter's got to change the way the beans flow because there's money in the system. He says, now for every 4-vessel coronary artery bypass we pay for, by the time you pay the surgeon and the OR and recovery and the anesthesia and rehab and all that, by the time the patient limps out of the hospital, cost us ballpark $250,000. So if you've got 100 middle-aged guys and over 10 years, we expect 40 of them, 50 of them, are going to have some kind of cardiac problem, and only 2 do. For every heart attack that doesn't happen, for every chest we don't have to open, we're sitting on $250,000. We'll happily pay the doctor $10,000 for keeping his patient healthy. We'll pay the patient $10,000 for staying healthy. We'll pay the clinic $10,000 for coaching him along, and we're still sitting on $200,000 profit. There's a whole different way of looking at reimbursement. It's quality-based healthcare, where there's value-based healthcare. There is value to the community for every CEO that doesn't go down with a heart attack, who stays on the job, paying taxes, employing his patients. That's worth something to the community, because as noble and wonderful as our profession is, on some level, most of healthcare, it's money lost. It's shoveling down a black hole. The guy comes in with his bad angina. He's all clogged up from his cheeseburgers and his pizzas. And you take him to the OR and you do the procedure, and you take the veins out of his legs and graft it onto his heart. And he's overweight and hypertensive. He has a hell of a recovery course, and he gets a postoperative pneumonia and a wound infection. And you have to take him back to the OR. And by the time he leaves the hospital, it's cost $500,000. And he goes home, not a word was said to him about his diet, so he can go out and eat more spare ribs and pizzas and burgers to clog up his graft again. What was gained by that? We're poorer for that, and the patients, poorest of all. He says that's money wasted. So we need to reward the doctors for keeping people healthy. It's an old time concept. They say in ancient China, you pay the doctor while you're well, and as soon as you get sick, the money stops. And so it's in the doctor's interest to keep you healthy, and we need on some level to do that inversion of the on our medical care system. How long do I have? Another few minutes here?
Just a second here. Yeah, it's about 6:59. we can, you can, if you'd like to go another 5 or 10 minutes, that's great. And then we have 20 minutes for Q&A, or we could go to Q&A earlier if you'd like to.
Great, sounds good. Let me just finish up with the money in the system here. An old story. The fable goes that there's a little small town, everybody knows each other. And one Sunday morning, the peace is shattered by the sound of breaking glass, and everybody runs into the central square. And there's the town bully kid, the teenage kid who's known for getting into mischief. And with a smirk on his face, and it's obvious he's just thrown a big rock through the pane glass window of the baker. And people are around him, they look at the broken glass, they look at him, and they're getting angry. You hoodlum, you vandal. And at that point, the head of the Chamber of Commerce steps forward and says, no, don't be angry at him, the boy's a hero. Because of what he did, the glazer who's going to replace that glass window is going to make some money off of this. He's actually helped the economy by doing this. It was a good thing. We should not be chastising him. And at that point, the economics professor from local college steps forward and says, no, it doesn't work like that. It's true, the glazer is going to make $300 for the glass pane he's going to replace. But the baker's son is getting married. And the baker had $300 that he was going to give to the tailor to have a new suit made for the son's wedding. But now he's got to use that $300 to replace the pane glass window. The tailor is out the $300 that he would have made. The boy, the groom, is out the new suit that he would have had. And when all this gets done, what do we got? We're back to where we were that Sunday morning before the rock is thrown. Nothing has changed. But the tailor is poorer, the baker is poorer, the baker's son is poorer. Do not mistake the circulation of money for the creation of wealth. Two different things. And we keep getting seduced. All this money, wealth is sending kids to college. Wealth is putting internet in everybody's home. Wealth is digging a new well for fresh water. It's college scholarships. It's real things that benefit the community. That's creating wealth. Back to the medical care, the bypass on this guy to go out to eat more cheeseburgers to come back for another bypass. No wealth is being created there, just the opposite. That money could be used for so much else. Those were college scholarships that could have been given for that $500,000, that's new sewer lines, that could have done something real with that money. So that's why we got to start paying people to get healthy. Everybody will benefit, the people, the economy, the medical profession. And so, and Dr. Lieberman knows this, and he's watching his colleagues practice old style medicine. And the desiderata says, speak your truth quietly, and he needs to do that. But I can see he's a man of truth, and he will speak it. He picks his moments, and he will, the Texas Rangers say there's no stopping a man who knows he's right and keeps on coming. And Dr. Lieberman and all the cardiologists out there I have just tremendous admiration for who they are and what they're doing. So just the last couple of minutes, what I've been doing. Well, last time I saw you a year ago, I was on a very intensive lecture tour of the nation's medical schools. I went to 25 medical schools last year, talking to the first, second, third year medical students, saying, it's what your patients are eating. But before you order another $1,000 scan or another $500 set of blood tests, ask your patients what they ate yesterday. And if it's full of burgers and buffalo wings and pepperoni pizzas, that's why they're sitting in front of you, doctor. Send them to the plant-based dietitian. Let her do the counseling. Let her show them the movies. Let her take them shopping. You see them back in a month and see if they're not leaner and healthier and doing better. That's how medicine should be practiced. And just to put that idea in their head, I'm giving them the lecture I wish somebody had given me 50 years ago. It would have changed the entire trajectory of my medical career. Where somebody had told me this, that it's the food, it's the food, it's the food. And so I was giving that message to the young docs, and they were very receptive, and still are. But along comes COVID this March. I had a big lecture tour lined up through the Texas Medical in Houston, San Antonio, went out to LA, up to Seattle, poof, gone. And so like everyone else who got COVIDized, time to go online. So I realized what I want to really tell the students. If I were the chief medical resident, and I had the students on my service row, what would I tell them as they're about to go out to the outpatient clinic and deal with these obese, diabetic, hypertensive, inflamed people who are in that state from what they're eating? What are you going to tell these docs? How do you equip them? The philosopher Goethe said, what you know about, you see. Once you know about something, you start seeing it. And as us plant-based docs, we know this. Now you start seeing it, see what diabetes really is. You see what obesity, you see what these GI, what colitis and Crohn's disease really is. You smear fast foods on the gut wall day after day, but it gets inflamed. No big mystery there. And so I said, you know, I could break this down to about 12 master classes. Sit down, folks. Here, if you're treating folks with hypertension and artery disease, here's what you need to know. Here's what the fast foods are doing. Let's look at what goes through the bloodstream after you eat a cheeseburger, fries, and a shake. And while we go through all the meat-based contaminants, the new 5GC, the endotoxin, the heterocyclic hydrocarbons, the TMAO, all of these. And here's what this one does. Here's what this one does. Here's what this one does. Do you see now why these arteries get inflamed? To the gastroenterologist, we have a master class on Crohn's and colitis. Here's what smearing this on the gut wall does. Let's talk about how the submucosal, the deeper layers react to these E. coli bacteria that stick to the gut wall from all the sugars and oils and fast foods that spawn this. And again, what you know about, you see, and I'm trying to open their eyes to this. So we've taken the course material and we put into 12 master classes on plant-based clinical nutrition. And so we've been doing it every other Sunday. If you Google, if you go to my website, drklaper.com, click on master classes, you'll see the course we're giving. We just did master class number 6. We're doing number 7 this Sunday. It's on fueling the plant-based athlete. And I've got 2 visiting masters. I got endurance athlete Rich Roll and strength athlete Robert Cheek. And the 3 of us are going to talk about fueling the plant-based athlete. And then the next week, we've got plant-based nutrition through the extremes of life. Prenatal, when a woman is preconception, plant-based nutrition through pregnancy, through childbirth, through nursing, through adolescence, all the way through the life stages to senior citizens. And we've got Brenda Davis, the plant-based dietitian, will help us, and Dr. Resma Shah, a plant-based pediatrician. And last, you can see the rest of the schedule. Anyway, it's the full body, if you will, of plant-based, how to use clinical plant-based nutrition to help your patients. And it's directed at medical students, young practicing docs out in the clinic, but also dentists and nurses and pharmacists and physical therapists and occupational therapists, anybody in the healing professions. Because we talk a little bit of science, but it's okay. If you've been to med school, you can handle a little biochemistry. And so we're looking forward to getting all this done. The last one will be January 20th, and people will be able to buy individual master classes or the whole block of them online if you'd like. So anyway, my focus now, since I'm not traveling around, is getting this all online. Once it's online, we'll turn it into a couple of books. And then hopefully we'll be able to travel again, and I can go continue talking to the medical students in person. What a joy that's going to be to actually walk into a room where there's several hundred people in the lecture hall, and not all socially distant. What a golden age that will be. Now we took that for granted. Okay, so anyway, things are moving in my world here. We're just trying to create a plant-based awakening in our noble profession here, which will affect everybody. How nice it would be to all doctors have this awareness. You wouldn't have to cringe when you took your plant-based question to your doctor. But speaking of plant-based questions, that'd be a good time to stop and open up for questions. So thank you for allowing me to ramble as I did.
Thank you, Dr. Klaper. That is excellent. That's great work that you're doing, and it just keeps getting better and better. So if people would like to put head to the chat box, put questions in, I can pick those off and read them to you. One question here was about let's see, if you can the website information again.
Right. drklaper.com. It's all spelled out. DOCTORKLAPER.com. If you go there, the masterclass will jump right out after. You'll see it there. Our overall initiative is called Moving Medicine Forward. That's my teaching of the med students, and the masterclasses is part of that. And again, 1 p.m. Klaper.
All right. And we've got, I think, just about 20 minutes. So hopefully we can get a bunch of questions in here and answer them quickly. Here's the first one. I've got a couple too, but tell us what you think of intermittent fasting while eating a plant-based diet. Is it necessary? And I mean like 10-hour eating window and 14-hour fast every day is what she mentioned.
Anytime you don't eat is a good thing. We live in this constant fed state here, and it's not no other animal really does that. Maybe cows do. I guess they graze all day. But it's good to give your body a break as we start shifting into the fasting state, which happens in the early morning hours. You don't get into full-blown ketosis, but your body, the metabolic wheels are starting to grind in that direction, and beneficial changes are happening in your cells. Molecules called sirtuins are appearing, and they snuff out inflammation and suppress cancer growth. Staying in the nighttime fasting state for a few hours in the morning seems to be a beneficial thing to do. And your body, most people's bodies likes that, wants that, because when I tell people, how many of you, when you first get up in the morning, are you famished? Well, you can't wait to get down to the kitchen table and start shoveling food into your mouth. Most people say, Doc, I'm not even that hungry in the morning. And that's the point. Your body has been burning a fat-rich fuel all night. It's perfectly happy to keep on burning that all morning. It doesn't need you to shove a bunch of carbohydrates in your mouth if you're not hungry. If you are hungry, by all means, go have some oatmeal and some berries on it and some almond milk. That's fine. But if you're not really hungry, listen to that and just drink water till you get hungry. And if that doesn't happen until 11 or noon, great. You've gotten another few hours in that fasting state. It's a good thing to do. So that's right. It's a nice thing to do, but don't drive yourself nuts if it's just not for you. Listen to your body. But if it's not hungry, it's okay not to eat.
And her follow-up question is, from what time until what time would you suggest? But I think she typed that before you said wait until you feel hungry.
Yeah, wait till 11 or noon to start. And by 6 or 7 in the evening, be done with food. It's not a good thing to be shoving sugars into your mouth at 10 o'clock at night for all sorts of reasons I won't go into. But so that window is between noon and 6 or 7 in the evening. That's about it. Have a little green tea in the evening if you'd like, or something that's not sugary.
Here's the next one. Any nutrition advice for migraines? I've been a whole food plant-based for about 2.5 years. I've had regular migraines about 15 years.
Oh my. The diet plays some role, it seems, in lots of people. That's all I can say. I can't say it's definitely from particular food, but in some ways it can be. Both the food itself can have chemical effects, releasing histamines and various vasoactive substances, but the food may spawn microbes down in your microbiome that their byproducts in turn that they release into the bloodstream as it flows up through the brain may set off the migraines. But so there's often a food-related issue. Sometimes it's just stress. Sometimes it's the time of the month for a woman. Sometimes it's the cigarette smoking that they inhaled on, and somebody walked by. There's other stimuli. But for whatever role food might be playing in your particular case, the one thing to do is play it like the folks with the inflamed joints or the colitis, is to cut your diet back for a week or 2 or 3, to do an elimination diet. Just cut it back to quinoa and steamed greens and steamed yellow vegetables and some non-citrus fruits for a week or 2, and then start adding foods back in one at a time. Man, what are you craving the most? Ooh, lentils. Great, have some lentils and see if it sets off a migraine. Give it 72 hours to see how your body reacts to it. If there's no problem, then put lentils on your good list. But if you eat anything and the next day you wake up with a powder, then maybe that's a food that you should be wary of. So you need to rebuild your diet and test each individual food. Probiotics maybe, omega-3s maybe. There's lots of things, nuts and bolts to turn to find your particular best food. But food combinations, but it still comes down to a whole food plant-based diet. Don't cheat on it with processed junks and restaurant meals, and there's usually some contaminant coming in that way that causes a problem.
Any thoughts on particular foods that seem to cause migraines more than others?
There's classic ones as far as some people find caffeine-containing food, chocolate and coffee, etc., makes it worse. Some people find that makes it better. Cheese is notorious if you're still a dairy eater. The tyramine in cheeses is notorious for setting it off. But everybody's different. That's why I'm saying you got to ask your own nervous system. Well, how do you feel about this food? And it'll tell you. It's a very liquid organ, your brain there when it gets upset.
Here's the next question, and we might, if Dr. Lieberman's able to contribute to the answer here too, that'd be great. It's can high cholesterol be hereditary? This is what my doctor is telling me and wants me to go on statins.
Well, I certainly have a view of that. Yes, sure. Of course, there's a genetic component, but this is an inflammatory disease. This is artery abuse. And I tell the cardiologist, cholesterol is not an evil molecule. That's why your liver makes it. Your adrenals use it for making cortisol. Your testicles use it for making testosterone. It's not an evil molecule, but it gets evil when it gets oxidized and the internal lining of the arteries gets ripped up and the oxidized cholesterol works its way into the artery walls. And this is the plaque formation is the tail of the dog of a chain of ongoing abuses inflicted upon the artery wall. The hypercholesterolemia does not automatically mean that the inflammatory disease of atherosclerosis is burrowing away in the wall of the artery. I've got vegans with cholesterols at 220, but their inflammatory markers are stone cold negative. Their high sensitivity CRP is negative. Their myeloperoxidase is negative. Their ultrasound scan of their arteries is absolutely pristine. These people do not have the disease of atherosclerosis because they're not injuring their arteries, even though they got a cholesterol at 220. I'm not going to put them on statins. The risk factors are all associated with, they're derived from and associated with Joe six-pack American cheeseburger eating, overweight, pre-diabetic guy. His cholesterol at 220 in him with sky-high inflammatory markers is dangerous. But that 220 cholesterol in my lean, healthy, marathon running vegan with negative inflammatory markers does not have the same import. So even though this cholesterol may be a little high, show me his inflammatory markers. Show me who this man really is, rather than this reflex. Oh, your cholesterol's up, you need statins. That's a fear-filled response because the cardiologist is afraid of getting sued if God forbid the guy has a stroke or a heart attack and they hadn't put him on statins, he's now medically liable and out comes that prescription pad. But doctor, you said, how healthy are this man's arteries is the real issue. And they don't look at that. They just look at the numbers. And because most of their patients are the cheeseburger eating overweight guy, it's true most of the time, but it's not good medicine. They're not being observant biologists to the man sitting in front of them.
Dr. Lieberman, I'm not sure if Dr. Lieberman's on, but did you want to add something to that? I don't see, he might have stepped away here.
Okay.
And there's a follow-up question.
Yes.
There's a follow-up question on that, that in regard to the tests that you mentioned, you said is CRP, carotid arteries, and what was the other lab?
Right. If you go to my website, drklaper.com, I did a video on this. It's called Beyond Cholesterol. See my video on Beyond Cholesterol, and I've got them all listed there. High sensitive CRP, oxidized cholesterol, prostaglandin 2, myeloperoxidase, phospholipase. These are all substances that appear in the bloodstream as the arteries are getting more inflamed and the plaque is getting bigger and getting ready to rupture. These numbers go up. If they're up, you should be concerned. But if they are stone cold negative, then you don't have that disease. And that's the important differentiation to make.
Well, here's a different area. Any advice for healing multiple sclerosis?
Oh my. Again, Dr. Roy Swank of the University of Oregon put his patients on a low-fat plant-based diet and reports great results. Other folks haven't reported those same results. It's certainly what to do, no matter how you look at it. A whole food plant-based diet. Should you add a little bit of omega-3 DHA in there? Maybe. We don't know what MS really is. It may be a viral infection of the nervous system. It may be a vitamin D deficiency. Why is it mostly in the northern latitudes? It seems to be an infectious disease. It's got a fascinating history. In 1941, the first year of World War II, in the Faroe Islands, if you look at a map and you see where the United Kingdom is, England, et cetera, right up well above them are the Faroe Islands. They belong to Denmark. And in 1941, there was never a case of multiple sclerosis among the Faroese who lived on that island. In 1941, 5,000 British soldiers got bivouacked on the Faroe Islands. Within 5 years, they were having multiple cases of multiple sclerosis. The disease had never been seen there. There clearly seems to be some infectious agent. It might be a protein like a prion. It might be a virus. Nobody's really sure. But I don't know what we're looking at with the true nature of this disease. That said, could the response to the virus or whatever it is be muffled down by a plant-based diet? Could the people do clinically better on a plant? I would think so. It's always worthwhile going to a whole food plant-based diet. But the more I learn about the disease, the less I can tell you that's the absolute cure for it. I wish I knew the cause.
And Dr. Stancic, who talked to us a few months ago,
yes,
had a lot of success.
Yes, she did well.
Plant-based diet and his marathon running, I think now.
Yes, remarkable.
Let's see, thoughts on a mostly plant-based keto diet, particularly for adrenal fatigue and or autoimmune conditions.
Yeah, I'm not a big fan of keto diets, vegan or not. Ketosis is an amazing magical state. When you stop, our daily fuel are carbohydrates. We are sugar-burning organisms. The mitochondrial enzymes that we have in our tissues burn sugars. We're glucose-burning organisms. If after 48, 72 hours of not taking in glucose, your body starts burning fats and you go into the state of ketosis. And it's a remarkable state. It sends chemical signals to the body to clean out. It thinks it's starving, so it engages in autophagy. It starts cleaning up cellular debris to throw it in the metabolic furnace and burn it. It enters a state of anti-inflammation, inflammatory reactions settle down on a fast or in the ketotic state, beneficial things happen. Cancer growth slows down, etc. but it's a stressful state. When you're not in ketosis, you're just burning carbohydrates. The waste products are just carbon dioxide that you breathe off and water that goes out through your kidneys. Sugar is a clean burning fuel. Glucose is a clean burning fuel. But you're burning fats. Now you're generating fragments of fatty acids, acetone, acetoacetic acid, beta hydroxybutyric acid. It's a dirty fuel that produces these acidic byproducts. Your body's got to deal with that. Your liver's got to deal with those acids. Your kidneys got to deal with it. Your bones got to deal with it. And staying in that state, your body can handle it for a week, 2 weeks. If you got to be, I'm sure our ancient ancestors found themselves when there was no fruit on the berry bush there. They had to fast for a week or two until they found their next food supply. And your body can handle a week or two of fasting in ketosis. That's fine. But to stay in that state week after week, month after month, if a little is good, more must be better. This is a stress on the body. Nobody's ever lived like this. And it's like, passing gear on your car. You're driving on the freeway and you want to pass a truck, you pull out, hit passing gear, off you go, great, pull into the main lane and take your foot off the gas. Wonderful gear, passing gear. But you don't want to drive to Seattle in passing gear. You will burn your engine out. Same thing with ketosis. It's fine for a week or two. Once every couple of months, a week in ketosis would do everybody good. But to stay in a ketotic diet is a acid-producing, stressful state to be in. There's no reason to do that. I think it costs more than it's worth.
A follow-up on on the intermittent diet. Is there an ideal breakfast time and an ideal time to stop in the evening?
Ideal breakfast when you get hungry in the morning. But if you know you got a big physical day, if you're a construction guy, you probably want to have a substantial breakfast. But if you're a kindergarten teacher doing Zoom classes all day, you don't need a big, massive breakfast. Maybe a cup of tea would be all you need. Listen to your body. Everybody's different. That's what hunger is for. So if you're going to eat breakfast, do it when get up. First thing I do in the morning is I get up and I go to the fridge and I pour myself 2 big glasses of water. Best thing you can do in the morning. You get dehydrated overnight. You're sleeping, you're not drinking, but you're losing water. You're making urine. It's coming out of your bloodstream. Every breath you take, you're losing water. There's water going out through your skin. Your blood's more concentrated in the morning. You drink that water. Give your kidneys fluids to flush out your bloodstream. Hydrate your cells. And it's youthifying. Your brain could use the extra water. So before we get into eating breakfast, have at least a glass, if not 2, of water in the morning. Then maybe a cup of herb tea. Start your morning off easy but liquidy first, and then listen to your hunger.
Here's a question about EPA. What do you think of the fish oil Vasipa?
Right.
It is only EPA to reduce inflammation in the body, or do you recommend algae omega-3?
I definitely recommend the algae omega if you're going to be taking it all, and I don't think everybody needs it. I don't think a young, healthy 30-year-old person who's eating, who puts a tablespoon of ground flax seeds and hemp seeds on a cereal and is eating a handful of walnuts and lots of green vegetables. I don't think they need to be taking extra DHA for 40 years till they get to age 70. As long as their diet's good. If they're living on granola bars and energy drinks, you can make a case for it. But if they're eating omega-3 rich foods, they don't need to be taking the algae. But if somebody's got inflammation, they have rheumatoid arthritis, they've got really, really dry skin, signs that they could use some more omega-3s, definitely the algae oil. The fish oil is notoriously contaminated with mercury and pesticides, and we are clear cutting the oceans. We are strip mining the oceans. We're going to be nothing left but jellyfish. We have used fishing up. We've used it up. The cupboard is bare. Let the fish off the hook. Let the oceans heal at this point. So stop with the fish oil. If you want omega-3s, get it from where the fish get it. That's from the algae. Much better, much cleaner all the way around.
We've got 2 minutes left and 2 questions left. One follows on what you just mentioned about water. What about warm water with lemon in the morning?
I'm all for it. That's lovely. I'm a big fan of water, as I just mentioned, and anything that makes the water go down. Something not a spoonful of sugar, but a couple of drops of lemon juice. That's lovely. It's a wonderful thing. It's an ancient, honored way to drink your water. So I'm all for that. Sure.
And what are your thoughts about fasting mimicking diet, researched, recommended by Dr. Walter Longo?
Walter Longo, yes, right. It turns out that some people have thought of actually doing a water fast is daunting, and it should be. And something don't undertake lightly. A day you can do, 2 days. Everybody can do 2 or 3 days at home, but more than that, you don't want to do on your own there at home. But Dr. Longo found out that if you just keep your calorie intake below 500 calories. In other words, eat salad all day. And so your total intake is mostly, salad is mostly fiber and water. As long as it stays below 500 calories, you go into that pretty much that same fasting state without all the hunger pangs. So it's a fast mimicking diet. You're still eating, but you get the effects of fasting if you keep the total below 500 calories. He's got energy bars and all this stuff, but you can do it pretty much just with a broth-based vegetable soup and a salad without an oily dressing on it. You can eat that during the day, and you get the advantage of fasting without actually having to do a fast. I'm all for it. Compared to eating cheeseburgers and pepperoni pizzas and buffalo wings, man, that's a lean, clean way to run an eating day. I'm all for that. It helps a lot on a lot of levels.
Excellent. Well, thank you so much, Dr. Klaper. This has been outstanding for your talk, your warm personality, and for answering all these questions. That's just outstanding. And I just to everybody else out there, thanks for coming. And our next, as I mentioned, our next meeting is going to be November 5th, so it's going to be early in the month, and it's not on our regular night. And it'll be Dr. Neil Barnard, and we're going to have some extra stuff because PCRM is going to be helping to organize that one. So, thanks so much. Thanks, Dr. Klaper. Thanks, Josh. Dr. Liberman. Thanks, Amberly. And we'll see everybody later.
Take care. Be happy. Stay safe.